See, in nursing and in fact healthcare in general today deals with the patient in a holistic way. The patient is more than just the illness or whatever the reason that they have presented to the health system. So we try to look at the environment they come from, the family situation, their spiritual needs, their mental needs, their social needs, their psychological needs. All of those things are a holistic approach to trying to meet the needs of patients and their families. The government of Saskatchewan did a review of the delivery of health services in the province, and as a result of that, a report was generated titled "For Patients' Sake," with recommendations about how we can make patient care better in the province. And Sun felt that that tied very nicely with a lot of the goals and objectives of our union, is so that we can provide a work environment where nurses can put patients and their families first.
And the key theme that came out of that report and the review was that the system wasn't too bad, but the system focused on the system. The system did not focus on patients and families, and many times patients and families felt that they were lost in this system. So patient and family-centered care was actually adopted, at least the context of it was adopted, from the Institute of Patient and Family-Centered Care out of the United States. And it focuses on about 4 things. The most important thing being collaboration with patients and families, respect for patients and families, and their participation, so that anything done with them is done with them and not to them.
Yeah, patient family-centered care means a great deal to me, and I know it means a great deal to the culture in our emergency room as well. What we can do is we can really bring the patient into their own care and into their own treatments and their own choices of their care and treatments. When we get a patient into our emerge, we try to discuss what is going on, what we think the plan should be, and how they feel that plan should be implemented, or what parts of the plan should be used.
It just means getting the families involved and making sure the patients are involved and completely informed the whole process, from the start of the first time when we see them all the way through their stay at the hospital until preparing them early for when they're going to go home, and making sure that the families are just as informed as the patients are, so that they can make really good decisions.
Patient family-centered care, to me as an RPN, it means that we have to start shifting our whole focus of how we do business. Generally right now we all come together as a treatment team, we kind of develop a care plan or things like that on how we think that the patient needs to do, but I think we have to start bringing the patient to the head of the treatment team and actually making sure that they're in all aspects of their treatment, their care, anything that may happen with them.
Patient and family-centered care means that you're actively listening to the client and their family to find out what the problem is and to help them meet a goal, that we all are working as a team towards one common goal.
Patient and family-centered care is about shifting our thinking as providers to see the system and to see healthcare from the point of view of that patient and family at that time in the system. So it is, sometimes we use the words patient-driven or patient-focused, but it's about saying, what does the system look like from the point of view of that patient at that time?
In my opinion, PFCC really enhances the quality of the patient's care in many ways. Number one, it'll always be education. Okay, because we get to take that time, we get to sit with them, we get to educate them on what's happening to them, what has happened, what will happen, and why it should happen, or why we feel it should happen. Then you have an educated patient, you have an educated family that can then converse with you and say, look, this is what we're comfortable with, and these are our needs. And I feel then the needs actually get met.
I think that just having conversations with patients and families gets a lot of information out that you never would have heard before. Or maybe you have someone who doesn't remember their history all that well, or they focus on certain parts of it, and you can learn a lot about the patient from talking to their families, and it helps us really understand what's going on with that person a lot more, and hopefully it stops us from sending somebody home with some pressing concerns they didn't talk about. Maybe they're going home to an environment that they're not safe in, or they needed some extra services, and if we might not have had that conversation with them, we wouldn't have learned those needs.
The family is always involved with home care when we're seeing clients, because they're quite often present during the visit. So they're quite often a caregiver as well. They're helping the client to remain in their home for as long as possible. And our goal is always keeping that patient independent in their home. And with the help of a family member, it just enables them to stay in their home longer.
I feel like we really empower people when we keep them involved, because then they know what to expect, they know what's normal, they know what to watch out for too, so they're not anxious sitting there thinking about what to worry about. We keep them hopefully from having return visits to the hospital by helping them to understand what brought them into the hospital in the first place. And then just keeping them safe, keeping them involved, and keeping them asking questions.
Patients feel heard and empowered when they have that knowledge about their own health care. They don't feel like we're taking control over them. They feel like they're of help to us when we're all working towards a common goal.
Us as nurses, we're the frontline staff. We're always there. We're 24 hours. We're providing the care, and who better to provide it? And I think that us as nurses, we're leaders in the industry. Like, I think we all have the same goal, is making sure the patients are well and they get services in a timely manner, and just overall general care. I think that Sun and Sun members are great leaders for that.
Adequate staffing is really important for a number of reasons. First of all, adequate staffing is important so we don't make mistakes in administering care to patients. But secondly, if we're truly moving to a patient and family-centered care, adequate staffing is required so we have the time to spend with patients, with their families, to get to know them as individuals. It's through talking with them that we identify many things that could be barriers to their recovery once they're at home. It helps us in places like long-term care, where people maybe have, through their medical conditions, their personalities have altered, to find out what that individual was like before this illness hit them. And those things are really important to make people feel like they have been treated as individuals and not as part of the system.
Having RNs and RPNs involved in patient and family-centered care feels to me like too weak a statement. I think they need to lead it. You know, RNs and RPNs make up the highest percentage of health providers in the system. Their education provides them with the skill set they need to coordinate and facilitate and support and coach and mentor. Those are all things you need in a patient and family-centered system.
We have over 10,000 nurses in this province, most of them represented by the Saskatchewan Union of Nurses. The information and the workshops and everything that Sun has been provided has got our nurses fully engaged in understanding. When you have the people on the front line, like I say, fully engaged in understanding, you have a much better ability to move something forward. It's called change, and change comes when people are educated and engaged and agree with it. And I think by Sun's adoption of this, you see a real engagement for some of our key providers in this province.
I think it's absolutely brilliant that the Saskatchewan Union of Nurses has taken on this leadership role in patient and family-centered care. Sometimes these kinds of innovations and initiatives come from, in a sense, the higher up. And I think that sometimes you do need some policy levers. So the patient first review that was done by Tony Dagnoni was it was an initiative by government to say, we really want to find out what our patients and their families want. But Sun immediately came forward and said, we, representing RNs and RPNs throughout the province, we actually have a leadership role as an organization to play in ensuring that our members understand what this is about, that we run workshops with them and with patients and families so that we start to create those relationships and new ways of looking at things. And they have a communication and relationship network, second to none. They can be in touch with their members in an instant, and the members go to the union to get the kind of information that will help them with their practice. So it's not just about labor relations, it's about professional practice as well.
The Saskatchewan Union of Nurses is very important with its members in the implementation and the sustainability of patient and family-centered care. They are the people that most often touch our patients and our families and our public. So by having them fully engaged in this, we have a much better opportunity to make this a reality. And to be able to make this a reality in a time that's not maybe 10 years from now, but maybe more like 2-3 years from now as we all get engaged and move it forwards.